Hi, I'm Dr. Hallie Leland. I have a doctorate in microbiology. I am accomplished and certified scuba diver and caver. I actively work at a scuba shop with my friend Mary, giving different cave dives to tourists. And I formerly worked for BARDA, but I was framed and kicked out.
Tell us about your first cave expedition with Barda.
So my first cave expedition, it took months to plan, and we were heading into the cave Cueva de Luz, which is a super cave. It's just a big cave where you go through many different types of obstacles, and there are different levels of cave. So we went all the way into the deep zone, but the goal was to figure out how deep this cave went. We actually didn't end up being able to do that, but what we did find was an extremophile called moon milk. And the reason why we called it moon milk was because it was bioluminescent, and it kind of had this eerie white glow similar to the moon. After getting up out of the cave again, me and a group of scientists explored moon milk a little bit more, and we discovered that its qualities was that one, it was very, very sensitive to all of the different types of environments that it was in. So it couldn't live in light, which makes sense because of where it was living in the cave. So we had to figure out one, how to contain it without it dying. And then we figured out that it could mutate very fast. When we added it to an existing antibiotic already, it would pretty much just make it 10 times stronger. So it'd be like a super drug. So the goal that we were trying to reach with the extremophile moon milk was to pretty much make a super drug to eventually combat in the future if we ever came across a super germ.
Tell us about why a second expedition was necessary.
That's the reason why we went back down into the cave Cueva de Luz was because one, my colleague Al Connor ran out of moon milk, so we needed to go retrieve more because there was an outbreak in Afghanistan of a new strain of ACE, and it was found in a soldier that was wounded in combat.
What exactly is ACE?
So ACE is an abbreviated way of saying Acinetobacter. Acinetobacter is a virus. It has 31 different species. The one that we most commonly associate with Acinetobacter is Acinetobacter baumannii. And so this specific strain of ACE is drug resistant, but it is not normally fatal. And you can obtain this virus by inhalation, ingestion, and wounds, which explains why a soldier who is wounded would have come down with this ACE. The primary infection where you would get ACE is in the lungs, but it can infect the urinary tract, bowel, and stomach. Another fact about ACE is that it loves hospitals, and it can live for months inside of different instruments used in the hospital, which is why it's the most dangerous. This can cause many outbreaks of ACE. It has one of the highest transmission indexes, which means it can transmit, multiply, and mutate within hours, and it exchanges genes with different bacteriophages. It's an opportunistic pathogen, which means that it only really will infect people who their immune system is compromised already. So, for example, a soldier who has an open wound, their immune system is already working very hard to keep that wound clean. So that is when ACE would strike, which is why it makes sense that ACE would strike there. An example of this happening in a hospital was an outbreak in 2002 where we just dusted off like this old antibiotic called colostin, and that pretty much cleared it up. However, this new ACE, which is different from the one I was just speaking about, grows in the bloodstream, which means that it will fight its way from the inside out as fast as it can. Along with that, the new ACE will attack healthy subjects, which means that it doesn't matter who you are, you don't have to have an open wound. It could just attack you and you could die. So that's why it is a level 4 pathogen.
So, what did you do to combat ACE?
So, as I was talking about, we were trying to use the moon milk to create a super drug to combat a super germ in the future. ACE was that super germ. However, my colleague Al Connor had ended up using all of the moon milk, so we had to go and retrieve more, which is why we went on our second cave expedition. In this cave expedition, we did not have as much time to plan because this new ACE virus was spreading very quickly.
What was done to prepare you to go into the cave?
I was brought in, debriefed. I was introduced to my team of 5. The first one was Al Connor, who I already mentioned. And the second one was Ron Height, who is a medical doctor in trauma, and he is a experienced caver. The third was Rafael Arguello, and he was the communications, because we were going into Cueva de Luz, which is in Mexico, and if we ran into any indigenous people, we needed to be able to communicate with them. And then the final one was Will Bowman. We didn't know much about his background. We only really knew that he was there to defend us and make sure we were safe.
Tell us about what you encountered inside the cave.
The first obstacle that we came across in the cave is what I like to call Don't Fall Wall. It's pretty much a canyon inside of the cave that is 523 feet deep. We had to scale down using some new biotech gear. And then the following space we had to make through was pretty much a very tight slit that was underwater. And we had to travel through it and make it to the other side where there was another cave. In this part, we ended up losing Height, which was very sad. His rebreather was cracked, and we weren't really sure how it happened. He must have hit a rock very hard. The next place we had to go to was the acid bath, and it's pretty much just a large lake full of acid. And we scaled the whole outer rim of the lake on a small ledge, and we ended up losing Arguello at that part. He must have fallen into the acid bath because Bowman had gone back and he was nowhere to be found. And then finally we set up camp after the acid bath, and I woke up after like 4 hours, and me and Al could not find Bowman. And it was horrible, and we didn't know what to do, but then we noticed that there was a river near us, and that he had probably fallen in. So after moving on from the campsite, me and Al went deeper into the cave and retrieved the moon milk, where when I was retrieving the moon milk, I ended up cutting my hand open and getting some of the moon milk in my hand. Al and I sterilized it, and I figured it would be fine as soon as I got up to the surface. After that, we started heading back out of the cave, and we made camp at the river where we had lost Bowman. And Al did something that I did not expect, and he turned on me and he tased me and tied me up. And once I regained consciousness after that, he told me that he had killed all of the people in the expedition, Height, Arguello, Bowman. He had caused all of their deaths. And I asked him why, and he said that he needed the moon milk to give to an outside source in order for him to get the rest of the money that he was promised. He also told me that he had framed me for selling inside information about BARDA to outside sources, and that was the reason why I got fired, because he wanted to learn more about moon milk and to regain more information for whoever he was working for. He ended up picking me up and throwing me into this, what he assumed, very deep hole in the cave. Somehow I survived it, and I made it out of the cave, bruised but alive. And then Al, assuming that I was dead, was not expecting me, and I came up behind him and I tried to pretty much just subdue him and make sure that he couldn't hurt me anymore. And I was hoping to get him out of the cave and make sure he got justice for all of his crimes. But he ended up tripping on something on the ground and impaling himself with a stalagmite, and he passed away in the cave. He was a dear friend, but obviously not someone that I knew, who I thought I knew. And so after that, I, from some miracle, made it out of the cave. And after some obstacles with outside men trying to kill me and the narcos, and then I found I ended up finding Bowman, who had somehow gotten out of the cave. After reuniting with Bowman, we made our escape with the moon milk.
Now, what did you find out about the effect that moon milk has on the ACE virus?
So after returning back to the lab, we had all of our guys on trying to figure out how to decode moon milk, and we found out that it actually mutated in the cave, so we couldn't do anything with it. I had already been in the hospital trying to heal after my trip in the cave, and so I found out that my best friend Mary's older sister, Lenora Stillwell, had been infected with ACE and was in the same hospital as me. I went down to visit her in level 4 PPE, and I was down there with her having a conversation. She went into arrest. So I started to perform CPR on her because I wasn't about to just let her die. So that means I had to take off my suit, and I was now going to be infected with ACE. So I performed CPR. She ended up being revived, and I was then quarantined. After like a day, I went back to visit her, and she had miraculously improved by like 10 times, and she was sitting up, all of her color was restored, and she ended up discovering that the reason why she was healed was because of the moon milk that had gotten into the cut of my hand, and me reviving her had been what cured her.
All right, Hallie, this concludes our interview. Thank you so much for your cooperation.
I'm Lenora Stillwell. I have an orthopedic surgeon degree, but I also worked as a trauma surgeon in Iraq during the war.
Explain your experience with ACE as a caretaker of soldiers with the infection.
So I first saw the ACE virus in one of my patients by the name of Daniel Lyman. He came in with a simple bullet wound, and he used a tampon to compress to stop the bleeding in the wound, which is a practice that most soldiers use during this time. And I told him, okay, we'll take out the compression and your shoulder should be fine, since it didn't go through bone, it just went through muscle, and it'll be a couple weeks until it's healed. I came back a day or so after treating him, and he looked worse. He had a fever, he felt hot, he said he felt achy, and he was in a lot of pain. So I boosted up his meds and put him on a different medication to try to get away if he had some kind of bacterial infection in his wound. And then the next time I came back, and I found him dead. On his face, I saw that he had a flesh-eating virus, so his face, part of his face was hollow. And then I began to see this more and more in a lot of my patients. And so in my perspective, I felt that I couldn't be putting on this protective equipment that was supposedly required by the government in order to help my patients. So I didn't put on this protective equipment, which eventually led me to getting the ACE virus myself.
Tell me about what you have experienced as a patient with the ACE virus.
So I was experiencing very similar symptoms as my own patients were experiencing. I was very dizzy, I was very tired, my throat was super, super sore, and I was having the flesh eat my legs and my arms from the inside out. And then eventually I went into cardiac arrest, and I had to have Hallie revive me because she was in the hospital room with me. And she ended up, when she was giving me mouth-to-mouth, she ended up getting saliva into my body from her own, which actually ended up saving my life because of the way that she was exposed to the moon milk through her own cut on her hand, and it had gotten into her blood, which therefore got into mine, and actually ended up saving my own life.
All right, that's all the questions we have today, Lenora. Thank you for coming out today. I am Nathan Rather. I am part of the President's Cabinet as the Health and Human Services Secretary.
Explain Biochem's influence in the U.S.
Biochem is far ahead of the technology available to the rest of the world. We invent health and safety technology for the government, often used for missions that are secret to the public.
What is your connection with the progression of ACE?
Within Biochem, I was part of a plan designed to make the company rich, which involved contaminating a specific population with the ACE virus.
What exactly was your plan, and where did it go wrong?
The plan was to get contaminated Chinese-made tampons into trailer trash welfare women. Tampons were perfect because they are sold unsterilized. Since they are not tested for sterility, they would be easy to contaminate. Women would use them, contract ACE, and spread the infection, creating a need to buy an antibiotic. That antibiotic would be colostin, which Biochem had secretly been stockpiling for over a year. Some would die for the cause, but most would be just fine with the antibiotic. However, we were not expecting soldiers to use these bacteria-infesting tampons to fix their bullet wounds. This would have been manageable, except the ACE virus mutated into a monster virus that was resistant to colistin and almost everything else. I learned this top-secret information through being on the president's cabinet and was able to form a second plan to get the moon milk directly to Biochem. This way, we could use it to create a new antibiotic against the mutated virus. I did not imagine that Hallie's team would actually be successful.
Have your extreme actions here affected your career?
Yes, I was forced to resign from my position on the president's cabinet. However, there was not a criminal trial because it would be disastrous to the president, so I was let off the hook.